Welcome to another episode of Ask Dr. Leila podcast, where we bring our lovely specialists in to get an insight as to what they do daily here in LH. Today we have a special guest with us, Roxana, our fantastic hygienist. Roxana is a strong healthcare professional who graduated at John Abbott College in Canada. She is a member of the Canadian Dental Hygienist Association and an experienced registered dental hygienist with a demonstrated history of working in the dental practice industry for over 25 years. Roxana, welcome to the show.
Thank you, Dr. Leila. I'm glad to be here.
It's a pleasure to have you. Let's start by addressing a fundamental question. For our listeners who may not be familiar, Roxana, what exactly is a hygienist?
Actually, a dental hygienist is a licensed oral healthcare professional who specializes in promoting and maintaining good oral health. Dental hygienists perform different tasks, such as conducting a thorough evaluation of patients' oral health, the condition of their gums, their teeth, educating them on their oral hygiene instructions. They can give them sometimes dietary advice that is good for their oral health, hence for their overall health. And they play a crucial role in preventive oral care. And they are a good part, actually, an essential part of the dental team.
Absolutely. I couldn't agree more. And thank you for that explanation. Now, one of the key questions our patients often ask is whether it's essential to visit the hygienist regularly. What's your take on this?
Visiting regularly dental hygienists, which we recommend normally every 6 months, ensures the patients to keep the optimal oral health. Because dental hygienists are trained to detect early signs of oral problems, cavities, gum disease, or so on. And by doing so, they assure that they can avoid any further complications or even more costly treatment after. And they can help you they can help patients to establish a good oral hygiene habit, which can help them in a long run and a beautiful smile and healthier mouth.
To me, this is all about prevention again.
Absolutely, yes.
Excellent advice. Now let's dive a bit deeper. We often hear about the connection between oral health and overall health. Could you share your insight on this relationship?
Oh, yes, I really believe in that. Oral health, a good oral health, is closely linked to a good overall health. As I always tell my patients, the head is connected to the body, and the mouth is the entrance of the body. So whatever is going in the mouth, it doesn't stay in the mouth. It goes into the body. For example, gum disease is a chronic inflammation, and which can release harmful bacteria and inflammatory byproducts, which travels into the bloodstream. And this inflammation is linked to diabetes, heart disease, Alzheimer, low weight birth babies, even preterm babies. And you're going to be surprised that even it can affect one's mental health. Missing teeth, for example, can affect patients' self-esteem, so it can affect their mental health. And then at the same time, even if they cannot chew properly, it can affect the digestive system and so on. So it is really closely linked to overall health.
These are all crucial points to emphasize. Now, let's discuss the relationship between you, the hygienist, and our other dental specialists here. How does your role interact with the work of other dental professionals here at LH?
Actually, dental hygienists in general, they can help other dental professionals by providing the prevention, preventive care, and at the same time educating patients and performing some procedures. For example, in case of gum disease, they can do deep cleaning, or even for kids, sealants. And there are many different tasks that dental hygienists can do. They do teeth cleaning, polishing, teeth whitening, and so on. Yeah, it can be done. It's a really good part. It's a combination, communication actually between the dental hygienist and the other specialists in the dental clinic.
100%. I see you as the first point of contact, actually, and then me as the general dentist, and then so on with our other specialists. Communication is key, and collaboration is key. Now, let's add a couple more questions. First, what are some common misconceptions about a dental hygiene that you encounter, Roxana?
There are a lot of misconceptions, for example, but what I always hear is that floss is not good for your gums because it makes space in between the teeth. Actually, this is not right. If they see space in between the teeth after flossing, it's because the gum was inflamed and was puffy. By flossing, the inflammation goes away, and they see space in between. Maybe that it was there before, but because they had that puffiness in the gum, so they didn't realize it before. Or if you don't have pain or your teeth look good, you don't need to see a dentist or hygienist, which is not true. A lot of times we see, Dr. Leila, we see a lot of patients without they say they don't have any problems, but we see some cavities. When we take x-rays, we see even more cavities that they are not even aware of that. And if we detect it in earlier, then they can avoid other problems after.
Absolutely. I mean, I always say, people can't diagnose themselves, There's a reason why we went through all these years of studies to become who we are. And for example, I go to my physiotherapist. There's a reason. I'm not trying to do my own physiotherapy at home. So the same goes. You need to have that specialist eye, and the years of experience says a lot. So valuable information. And lastly, what advice do you have for our listeners who may be anxious about visiting the hygienist or dentist?
We see that a lot, actually, that people are anxious about coming to the dental clinic. My advice to them is, again, communication is the key. Talk about your anxiety with your dental team. Tell them that you don't feel comfortable. Actually, here at LH, we have many different things to calm the patients down. For example, we installed a TV on the roof and then of the room, then it makes them distracted a little bit, from what is going on in their mouth. Or nitrous oxide, for example, that can help some patients to calm down. Come with someone if you feel more comfortable. Bring your AirPods if you want to listen to the music while we are working, because the sound, some people, they are not comfortable with the sound of our instruments. But talk about it. Don't be shy. You are not the only one who's anxious about
Absolutely.
going to the doctor.
Most are actually. Most are anxious. So,
yes.
As long as
men
you know
and
that.
women, doesn't matter. Yeah.
100%. Boys and girls. Thank you, Roxana, for sharing your expertise with us here today on the show.
Thank you for having me.
And as always, thank you for tuning in to Ask Dr. Leila podcast. And until next time, have a great one, everybody.